Hello everyone, I'm M. Tejasri of PharmD second year from Geetanjali College of Pharmacy. Today I'm here to explain about the obsessive compulsive disorder, which is also commonly called as OCD. Obsessive compulsive disorder features a pattern of unwanted thoughts and fears known as obsession. This obsession leads you to do repetitive behavior, also called compulsion. This obsession and compulsion gets in the way of daily activities and cause a lot of distress. Ultimately, you feel driven to do compulsive acts to ease your stress. Even if you try to ignore or get rid of bothersome thoughts or urge, they keep coming back. OCD often centers around certain themes such as being overly fearful of getting contaminated by germs. To ease contamination fear, you may wash your hands over and over again. If you have OCD, you may be ashamed, embarrassed, and frustrated about the condition, but the treatment can be effective. This is OCD cycle. Most of the patients suffering from OCD get obsessed with certain activity which leads to anxiety if it is not done, where again it leads to compulsion to do the activity compulsorily, which gives them relief after completing the activity. And the patient follows this cycle involuntarily over and over. There are certain types of OCDs, such as contamination OCD, perfectionism OCD, checking OCD, harm OCD, superstitious OCD, religious or moral OCD, sexual orientation OCD, and relationship OCD. Contamination OCD. In this contamination OCD, patients will usually have an excessive fear of germs, dirt, and diseases. They may fear of being contaminated by other people or by the environment, in which the patient shows the symptoms of like washing hands again and again because of the doubt of getting contaminated by germs or cleaning a particular area over and over again. This is a cycle of symptoms caused in contamination OCD where the cycle repeats again with obsession, distress, compulsion, and relief. Perfectionism OCD. Those with the obsession about perfectionism may exclusively concerned with the exactness and symmetry. They may worry about items that are not organized in a specific way or will perform compulsion for things to feel just right. In perfectionism OCD, patients always try to keep all the objects near them in a systematic order, following the all symmetry, including every minute detail. This is the cycle of perfectionism OCD, continuing the cycle to get the temporary relief. Checking OCD. Checking OCD is a subtype of OCD characterized by the obsessive thoughts and compulsion behavior relates to checking. People with this type of OCD may feel compelled to repeatedly check things due to persistent fear or doubt about potential harm or negative consequences. Like checking the stove knob continuously or switches. This is the cycle of checking OCD with symptoms. Harm OCD. Individuals who experience this type of OCD may have obsessive thoughts about harming themselves or others. Someone with this type of OCD may avoid certain objects or situations, seeking reassurance or engaging in mental or behavioral rituals to prevent harm. They may also repeatedly check a situation to make sure they have not caused someone harm. People having harm OCD try to keep all sharp objects or objects which may cause problem or harm to anyone away from themselves and also from the people close to them. This is a cycle of harm OCD where person might get distressed because of all the negative thoughts. Superstitious OCD. This type of OCD involves excessive reliance on superstitious beliefs or engaging in repetitive rituals or behaviors to prevent negative outcomes or to bring about desired outcomes. People with this type of OCD tend to believe in good luck and bad luck and get worried, or get distressed about the all bad luck outcomes. These are the symptoms of superstitious OCD, like believing in all unnecessary or unrealistic things to get good luck. Counting OCD. Counting OCD is characterized by an obsession with numbers and counting. Specifically, individuals experiencing this disorder have a strong urge to engage in repetitive and ritualistic counting behavior. Like they start counting when they are afraid of something or cannot figure out anything. They start counting to relax their mind. These are the symptoms of counting OCD, like counting to achieve a sense of rightness, counting to a specific number, counting to keep something bad from happening, doing things in specific number like in a group of 3, etc. Religious or moral OCD. This type of OCD involves obsession related to religion, morality, or ethics. This obsession may involve fear of committing sins or violating morals or ethic codes. Those with religious obsession may have obsessive thoughts, worries, or concerns surrounding moral judgment. They may have excessive worries about offending the religious ethics. People with this type of OCD mostly have the fear of God, like getting caught of their bad deeds and getting punished by the God. These are the symptoms of religious OCD, like fear of living in sin, belief of being unworthy of God love, fear of not reading the scriptures enough, etc. Sexual orientation OCD. This type of OCD involves obsession related to one's sexual orientation or identity. This was known as homosexual OCD, but this is misleading as it can happen to anyone regardless of gender or sexual orientation. These are the symptoms of sexual orientation OCD, like checking our bodies for signs of sexual attraction, testing our sexual attraction, fear of what other people might think, avoiding people, places, and things that might trigger sexual oriented OCD, obsession, etc. And last type of OCD, relationship OCD, which is also known as ROCD. Many of us occasionally experience varying levels of relationship anxiety. Individuals with ROCD may experience intrusive and repetitive thoughts about their relationship, their partner's quality or flaws, and may engage in compulsive behavior such as seeking reassurance, constantly checking their feelings, or engaging in mental rituals related to their relationships. These are the symptoms of relationship OCD, like fear of not being good enough, questioning the strength of our relationship, Googling signs of healthy relationship, obsessed with a partner's perceived flaws, etc. OCD is caused by genetics or neurological conditions or behavioral conditions or environment. General treatment for OCD are psychotherapy, relaxation, medication, neuromodulation, and transcranial magnetic stimulation. These are the non-pharmacological managements like relaxation, superficial massages, breathing techniques, music therapy, spiritual practices. These are the medications of OCD. Several medications can be used to treat OCD. The most commonly prescribed medications include selective serotonin reuptake inhibitors SSRIs, fluoxetine, flevoxamine, sertraline, paroxetine, escitalopram. SSRIs are typically the first-line medication treatment for OCD. They work by increasing serotonin levels in the brain, which can help reduce the symptoms of OCD over the time. Serotonin norepinephrine reuptake inhibitors SNRIs. Clomipramine. Clomipramine is a tricyclic antidepressant that affects both serotonin and norepinephrine levels in the brain. It is often used when SSRIs are not effective or tolerated well. Other antidepressants venlafaxine, an SNRI that may be used in some cases, augmentation agents, aripiprazole, an atypical antipsychotic sometimes used as an augmentation strategy when SSRIs alone are not sufficient, benzodiazepines, clonazepam, lorazepam. This is a pharmacological management of OCD. The OCD patient gets a conventional treatment option starting from first-line pharmacological treatment, where SSRIs are given. If the patient responds to the treatment, it is continued. If not, the second-line pharmacological treatment is given, where citalopram and mirtazapine is given. If the patient responds to the treatment, it is continued. If not, the CBT, conjunctive behavioral therapy, is given along with pharmacological treatment. If the patient suffering from OCD shows severe symptoms, the treatment is given with combination of SSRI and CBT. If the patient response after 12 weeks is positive, continue the monotherapy for 1 year, considering discontinuing medication in period of low stress. Consider using CBT and increase monitoring of patient during medication discontinuation. And if it is negative, receive maximal tolerated dose of SSRI, switch to different SSRI or CMI, check adequacy of previous CBT treatment. And if the patient shows moderate symptoms, CBT monotherapy is given, and if the patient response is positive, slowly taper the CBT session frequency. If it is negative, start SSRI, and if patient's response is positive, slowly taper CBT session frequency, continue monotherapy for 1 year, consider discontinuing medication in period of low stress, consider during CBT and increase monitoring of patient during medication discontinuation. And if it is negative, receive maximal tolerated dose of SSRI, switch to different SSRI or CMI, check adequacy of previous CBT treatment. Patient counseling. Counseling for OCD involves several important components to help individuals manage their symptoms and improve their quality of life. Here are some key aspects that are typically addressed in counseling session of OCD. Education for OCD, identifying triggers, cognitive behavioral therapy, CBT, exposure and response prevention, skill building, support and reassurance, medical management, family involvement, etc. include patient counseling. So guys, thank you. Hope you liked the video. Stay healthy physically and mentally. Thank you. Bye.